A diagnosis for Laura Jean Covey from To All the Boys I Loved Before. In the film, her secret love letters to five boys are mailed out by her little sister, leading her to get into a fake relationship with one of them, Peter Kavinsky, to avoid an awkward confrontation with her sister's ex-boyfriend, another recipient of her letter. From here, she is forced into situations of emotional vulnerability and social situations she would usually avoid. Laura Jean comes from a Korean American family, and her cultural background plays a subtle role in shaping her identity through her close relationship with her sisters and their Korean traditions from their late mother. Growing up in a warm but protective household leads her to become more responsible and emotionally cautious. Overall, her high school social dynamics, family expectations, and multicultural background heavily influence her romantic anxiety, her desire to stay in her comfort zone, and tendency to romanticize life instead of expressing her feelings openly. So I decided to diagnose her with social phobia, also known as social anxiety disorder, which is the fear of being criticized or doing something embarrassing. And this anxiety can lead to avoidance that can be disruptive in relationships, daily work routines, work, school, and other activities. Social phobia is heavily stigmatized in our culture. One common misconception is that feeling socially anxious is a personal failing or a sign of weakness. Another stigma is the cultural emphasis on sociability and extroversion, where being anxious or introverted is seen as more undesirable. And as a result, this may make a lot of individuals who are diagnosed feel embarrassed to acknowledge their experiences and may lead to them feeling more lonely and isolated or even worse in their symptoms. Overall, social phobia is not diagnosed equally across all cultures. In one study, it found that Latinos had significantly lower rates of diagnosed social phobia compared to non-Latino white adults due to Latinos being less likely to endorse the initial social fear screening questions, contributing to more underdiagnosis. This demonstrates that cultural norms, language familiarity, and how people interpret social fears can impact whether the disorder is diagnosed or recognized. So in the film, she displays the avoidance of anxiety-producing social situations because she tends to avoid confronting her feelings, talking to the boy she likes, going to parties, and addressing conflict directly until she meets Peter Kavinsky. However, for example, she does run away after he confronts her about the letter, and she does try to avoid romantic interactions with him at first because she fears embarrassment. And this reaction can be supported by a study done by BMC Psychology, where individuals with higher social anxiety display avoidance and visible distress during social interactions. Symptoms she did not display is excessive anxiety that's out of proportion. Even though she gets nervous, her anxiety wasn't extreme and she still was able to function in school and maintain strong relationships, friendship-wise and family-wise. The best treatment for her would be cognitive behavioral therapy. An important part of this treatment is social exposure, where she would gradually practice feared social situations, such as starting conversations, expressing her feelings directly, or participating more actively with peers. This is an appropriate treatment because it directly targets the thoughts and behaviors that maintain the condition. And in one empirical study, it found that CBT for social anxiety contributes to large lasting improvements in symptoms, even when delivered in routine clinical practice. There are some potential barriers that could interfere with her receiving treatment. For example, she is a Korean American teen, so she may have been raised with cultural norms that prevent her from expressing her emotions openly or encourage keeping personal problems private. And this can make therapy feel uncomfortable or unfamiliar to her. She also has many family responsibilities as the older sister at home, which could limit her time for treatment or pressure her to hold everything together. So, although this film portrayed many behaviors that align with aspects of social anxiety, the portrayal is incomplete due to her still being highly socially functional. She maintains her friendships, attends school comfortably, and she's not impaired in multiple life domains, which is a significant component in clinical diagnosis. And even though the emotional experience is displayed, the film still minimizes the severity and daily impairment that comes with social anxiety. Film portrayals play a significant role in shaping our beliefs about mental health conditions, especially for those who have little firsthand experience. For example, movies can connect with their audience by normalizing emotional struggles or reduce stigma that comes with the disorder. And on the other hand, they can also downplay the severity of the disorder or romanticize the condition, resulting in people underestimating how serious the disorder can be, and in this case, social anxiety. And thank you for watching.